what is emergency medicine? What emergency medicine exists in world? We don't have idea. In our countries, we don't have idea. Neither the public, neither the hospital. They don't have idea. So there are two most important things in the emergency department for emergency medicine of any country. There are pre-hospital and hospital care. Pre-hospital includes that if any emergency happens, it can be trauma, it can be any medical emergencies, any incident, any major incident, any casualties that happen. That's a common thing that Pakistan many casualties happen in previously and that are happening. So the hospital is when that happen that field to transferring of patient from that field to the hospital. We have a rescue department, and in other countries and other provinces, they are also following it, like rescue teams. They are arranged pre-hospital care, but that not integrated or as developed as the developed countries have. We don't have air ambulances. We don't have proper trained staff. Although with the minimum resources, I want to salute the rescue and I had some workshops with them. So they are doing their best. But we are far, far behind from the developed countries. So next comes the hospital care. So hospital care, whenever patient enter to the hospital, so emergency department is the frontline specialty who will be handling any patient coming to the hospital with any life-threatening condition. If they are not trained, if they don't have a well-structured department, if they don't have equipments, they don't have resources, then patient is not going to survive. Any patient who is coming with life-threatening condition, if that happens, so emergency medicine is the frontline department, is the front of any hospital. If you want to make a best hospital, your emergency should be well developed, well you have human resources in your emergency that should be well trained. So frontline specialty, that's what I mentioned. And because they have to manage it, they have to treat it, they have to diagnose and then do the critical intervention. That's very important. How is the emergency department in Pakistan? That I told, we don't have a proper emergency department in any government hospital of Pakistan. So emergency department exists in any government, and especially in Punjab, what I know in Sindh, there are no, I think there are one or two. I have heard about them. There's one hospital in Peshawar that they are running. They have hired consultant from UK, but I don't know that it is working on the international standard or not. But there are some private setups who are trying to work as per the international standard. In Pakistan, emergency department is developing nowadays. Nowadays, there is a boom for the emergency department. Before I entered this field, I was interested emergency department, but I was not a trained doctor. Before entering into emergency field, I want to tell you that the course I have done, I did not know anything about the emergency department, that how it exists. Okay, I think someone had asked question. So no emergency department is developing in Pakistan, and some hospitals are trying to develop, but on government level, I can't see any development in emergency department. So in UK, where I am right now, the emergency department, emergency medicine was recognized as a single or separate specialty in 1970. And I want to tell you that either in Pakistan, it was recognized from last 3 to 4 years back, it was recognized as a separate specialty. And still in Punjab, what I know about, there we are producing only 4 to 8 FCPS doctors. Still we have in government hospital. 3,000 or 4,000, we are producing only 4 to 8 trained doctors. They are trained as per international standard or not, that's the different debate. But in Mayo Hospital and Holy Family, they are trying to improve their emergency department, but still they don't have any standardized emergency department in Pakistan. So how the Pakistan is like in UK, there is the National Health System, and they have a Royal College of Emergency Medicine. There is a separate college for them who train the emergency physician, who recognize the courses, who do the trainings for that. They have developed different courses, different guidelines for their emergency department. But in Pakistan, we have nothing. We FCPS, that is a very recognized fellowship program or specialist program in Pakistan. They started their emergency medicine residency, I think, 4 to 5 years back. But a few organizations are working. Pakistan Emergency Medical Association, which was started by Dr. that happened. We don't have a mechanism that what we are going to do. In UK, if any casualties happen, any incident happens, then they have a plan. Every hospital have a plan that they open that folder, they follow it. We don't have such plans. We have to work on it. The public health students who are listening. So as a public health officer, as a public health students, we must conduct researches on it. We must conduct webinar conferences to integrate the emergency department, triage of the emergency department. And also we should, when I was doing MPhil public health, so my topic was on the quality care of emergency department. I mean, patients' quality care in different emergency department of Pakistan. So when I presented my thesis to external examiner and he was surprised that no one has in my life, no one has done any thesis on the emergency department. You are the first person who did. No, so that's the importance of emergency department, that no one knew about it. No one ever tried to do thesis. No one tried to researches. So from last 1 to 2 years, I have seen that there are people who are doing research work on the emergency department. So if as Vakas, my friend, and you are from public health department, you must start doing some research work on that, from pre-hospital care, hospital care, on infrastructure. Do some researches, read the articles, and then implement. Do some research and talk with the governments that they should implement those developed thing in our Pakistan. So infrastructure. So we have a limited diagnostic and limited facilities, limited ambulances, everything staff. We don't have a infrastructure and facilities. Training and education, that I told, in UK, they are training their emergency physicians. Their training includes 6 to 8 years. But in Pakistan, no FCPS that was started 4 to 5 years back, and there are some programs who are training the emergencies. Such program that I was also affiliated with. I am affiliated with it. That's the London Global Emergency Medicine. So next, these are the training and education infrastructure. So next come the challenges in Pakistan. So first of all, as a underdeveloped countries, the big challenge is lack of funding. So the preference of our governments is not the health and education. In developed countries, who are developed countries, either it's America, either it's Germany, any European country, any that United Kingdom, Ireland, their preference, they spend a lot of money on health and education. As a public, as a Pakistani, if you visit or do a research in public, as a nation, we also don't spend money on education, on health. If our pay is 1 lakh, we don't spend money on education. We only spend 5% on education. We will find a school which is not getting a lot of fee. We will admit our children there. We will spend money on our mobiles. We will spend money on our luxuries. We will spend money on everything. We will not spend money on education, on health as a nation. So that's what the politicians are doing. If politicians are doing like this, that they are not at fault, because as a nation, it's our blood that we don't spend money on education and health. That's the I'm telling about, not about 90% public that I observed in my life. So lack of funding, government does not spend a lot of money on the health and education, and they don't have a concept of emergency department that they should improve it. So other thing that there is a limited training awareness about the emergency specialties, because emergency. So emergency medicine is not recognized, is not considered as a separate specialty by the government, not a separate department. So that's why they are not spending a lot of money, a lot of funds on it. And the other thing is that we don't have pre-hospital care and ambulance systems. Yeah, there is a rescue department is working, and ambulance department exists. So, but that is not also well developed as like our emergency department. If any casualties happen, do we have a plan? Do the rescue team? Yeah, because they most of the time they are non-doctor, they are paramedics, or they have very short trainings. They have done a very short trainings to how to deal with the emergencies. So they deal their own way. They are not at fault, because we don't have a pre-hospital care. Then patient comes into the emergency department. Do we have the resources? Do we have the funds? Do we have the diagnostics test? Do we have the trained doctors? So that's what happened. So when the patient comes to the emergency department, doctors try to save the patient, try to manage the patient, but due to some resources, due to lack of funds, lack of infrastructure, most of the patient quality that compromises. So then the calls happen, then the fights happen in the emergency department. That's the routine in Pakistan. So overcrowded public hospital and delayed referrals. So the main problem is that what the public health officer or public health students they can do. So I want to say that मैं इसको उर्दू में कहूँगा ताकि ये पब्लिक के लिए भी आप इसको कर लें कि अवाम जो है उसको भी आइडिया नहीं है कि हमने इमरजेंसी में कब जाना है और कब नहीं जाना। उनको इस चीज़ का आइडिया नहीं है। आप यहाँ पे यूके में आए, एनएचएस में आए, पेशेंट जो है 6-6 घंटे तक वेट करते हैं, और छोटा सा मसला है उसके लिए तो आपको वो कभी एंटरटेन ही नहीं करेंगे। यहाँ पे एक दफ़ा तो काफ़ी दफ़ा ऐसा हुआ, बल्कि एक दफ़ा नहीं, पेशेंट जो है रात को आ गया जी। मैंने कहा जी आपको तो ज़रूरत नहीं है, आप इमरजेंसी में गए। डॉक्टर साहब हम तो यहाँ से गुजर रहे थे, तो हमने कहा जी इमरजेंसी से ही होते जाए। ठीक है, रात को एक पेशेंट आया, उसने कहा जी, ऐसे उंगली दिखाई और कहा जी ये है मुझे यहाँ पे पता नहीं, छोटा सा कोई बिल्कुल भी मतलब कि कोई इस तरह का नहीं था। वो कहता है जी रात के 2 बजे। क्या है जी, मैं इधर से गुजर रहा था, मैंने कहा इमरजेंसी से होते जाऊँ। या फिर क्या करेंगे जी, हम शादी पे आए हुए थे, हमने कहा जी इमरजेंसी में। तो लोगों को आइडिया नहीं है कि इमरजेंसी में कब जाना है। इसके लिए भी पब्लिक हेल्थ के जो स्टूडेंट्स हैं, पब्लिक हेल्थ के जो लोग हैं, उनको इस पे अवेयरनेस कैंपेन, सोशल सर्विसेज के लोग हैं, उनको अवेयरनेस कैंपेन जो है वो स्टार्ट करनी चाहिए इमरजेंसी में कब जाना है। क्योंकि अगर आप क्या होगा, फिर एक बंदा इमरजेंसी में जिसको जरूरत है वो आया है, उसने क्या किया, अपने साथ 2-3 बंदे और आ गए, उन्होंने भी साथ पर्ची बनवा ली। तो उससे क्या होगा कि जो जिस बंदे को इमरजेंसी में डॉक्टर को देखना चाहिए था, उन 5-4 बंदों का जो टाइम है वो दूसरे पेशेंट्स ने ले लिया, जिस वजह से वो पेशेंट जो है कंप्रोमाइज हो गया। तो ये पब्लिक हेल्थ लेवल पे इसकी अवेयरनेस की बहुत जरूरत है। नेक्स्ट वी विल मूव ऑन टू आवर इंग्लिश, नो वरी। तो brain drain, brain drain is like that. I have moved to UK, so that's also called a brain drain. If I was a government employee in Pakistan, so if my government is serious in doing something for the emergency department of Pakistan, they can hire emergency physician, trained emergency doctor from Pakistan. There are a lot of doctors who want to go back to their country. They want to serve, but our government should provide them resources, should provide them funds, should provide them facilities to serve their own nation. But they are least interested. But they are, because they don't want to spend on the health, they don't want to spend on the education. They want to spend only on those things which which is visible. So they don't want to spend the money on things which are not visible. So that's the main problem. So the main topic, but I have also told mentioned in between about the emergency medicine and public health integration. So as the emergency department is the frontline surveillance points for public health threats, if any outbreak happens like COVID, the emergency department was facing the COVID patient. I was working in the emergency department in the COVID days. If there is any dengue outbreaks happen, if any measles happen, so they will first visit the emergency department. So emergency departments are the first line. So they public health officers and emergency department, they can coordinate, they can integrate with each other for the detection of any outbreaks and for collecting the data and for implementing for prevention of diseases. So that's for campaigns. So that's the integration that can happen between the public health and emergency medicine. So emergency medicine, they can play a key role in injury prevention and disaster management. Like Dr. Vakas and Dr. Vakas was the main author, and I was also coordinating. And then we did research paper. We published it when we were students. That our research was on the quality of road quality of patient care and road traffic accident patient. That was our topic, pre-hospital and post-hospital. So there was a lot of stories people were telling. So that is very important that public health officers and emergency medicine physician, they should integrate with each other to how to prevent the injuries and how to prevent the disaster and how they can manage and what on the public health level, that if you will see that we don't follow the rules of traffic, we don't wear the helmets, we don't follow the red lights, that's the public health officer level things that they must do. If they are doing work on the public health level, they are arranging campaigns to prevent that, to promote the wearing the helmets, to promote the following the rules of traffic, and then it can save the injuries, it can prevent the injuries, it can prevent the head injuries. So that's very important at the public health level. So if emergency department public health are integrated with each other, so whatever the patients are coming to the emergency department, like when I was a student, there was a one poison, one suicidal case was very common. That was I don't mention here. So that was very common. So only the emergency department doctors knew that this is very common, but no one was doing research, no one was doing to prevent it, no one was doing awareness campaigns on it. If the public health and emergency department are coordinating with each other, they can ask the public health officer, they can ask the social services department to start campaigns on it, how to avoid it, how to how this event can be prevented before coming to the emergency department. Because primary prevention, that's what the public health do. They save the patient before having the disease, before having the incident. So that's what the public health officer do. So in UK, there are real-time surveillance linked with ED and public health. If we are working here, so what we do, if we find any patient that we should have to report to the public health officer, we should report. If we will not report, we will be answerable. So that's very important. If I have encountered any hepatitis case, any COVID case, any dengue case, any malaria case, I have to inform the public health officer. So that what not happened in Pakistan. Other thing that in emergency department, so there are no data integration. We are not saving the data for patients who are coming to the emergency. So that's why we don't know what diseases are common in the emergency department, what's happening. So that we are doing in Pakistan, I say that we are doing searches instead of researches. We do only on the search on Google, and then we utilize it for the research papers. So that's so EM public health collaboration. That's very important thing. That's what we do. So what is recommended that we should establish emergency medicine curriculum, emergency medicine training program. We should develop the national trial system, emergency care standard. We don't have any standard at any level. We should formalize our own emergency care standard. We should strengthen our public health with the emergency department, their integration, so they can share the data. We should invest in infrastructure, technology, ambulances. We should make it advanced, and we should train our pre-hospital care staff and hospital care staff. The other thing that we should build public-private partnership for the emergency services. That's very important. And we should start continuous education. That's very important. If you have a well-equipped person, but if you have a car, but you don't know that how to run the car, how to drive it, then what's the benefit of it? So that's why training and education is also very important if you after the development of the emergency department. So as a public health students, I want to say again that you should start doing research and visit the emergency department, do some researches, webinars, and that's what I want to say. Any question you can ask. I want to thank the Public Health Awareness and Training Center and Dr. Waqas, my friend. Thank you very much. That's all.
Okay, thank you so much, Dr. Badruddin Khizar, for such that incredible, insightful, and engaging session. And you have given us so much, especially the public health students, about regarding future emergency care and public health integration. And so now we will move to our Q&A session. Guys, if you have any question, please feel free to ask them. You can either unmute your mic to ask sir directly, or you can drop your question into the chat box and I will read it out for you.
Okay, I think they don't want to ask a question. How will they do the research? Okay, Fatma, you are a public health student?
Yes, sir, I am a public health student at the University Institute of Public Health.
Okay, so inform the Waqas that when you are going to do any research on the emergency department.
In fact, I have already conducted a research in my 4th semester. Currently, I'm in my 6th semester, and I have conducted a research in my 4th semester on the assessment of psychological burden among caregivers of hemodialysis patients in Lahore. And now I am working to getting it published, inshallah, soon.
But I am saying, yeah, that's good. You have done
Thank you.
research, but I am saying that you must do some research on an emergency department.
Inshallah, inshallah, inshallah.
Okay. So these are all students. So you are from University of Lahore.
Yeah, yes.
Okay. So that's
I'm a student of Dr. Waqas.
Yeah, anyone can ask any question. So, because you are open to ask, I know there's no freedom of speech in Pakistan right now, but you can ask anything. Don't worry.
Yes, guys, you can drop your question into the chat.
Assalamu alaikum, sir. Can you am I audible to everyone?
Walaikum salam. Yeah.
Yes, ma'am.
Okay. So my name is Ikra. I'm also working as an assistant professor, and I have a versatile experience of giving trainings about the emergency medicine and pre-hospital emergency care council, and I'm trained by the National Ambulance Service College Ireland and UCD. So I would like to add one thing about that. The system of pre-hospital has been introduced in Pakistan after the earthquake of 2005. So we as a nation need to train ourselves. It's not about the particularly a duty of a healthcare professional or student of a public health. I think it's a duty of a nation. We need to be trained as a nation about this emergency responsiveness. So triage assessment at the time of the massive, incidents, and what should be done to the patient of trauma at the roadside, what are the basic checklists, immobilizing the patient, each and everything. This is actually a training this is the training that we lack as a nation. So this was a very good topic that you covered it. So I think there is a lot more need to do for the people, not only for the healthcare professionals, but I think it is a duty of everyone to have the knowledge about this.
Yeah, thank you. Your name is Ikra. Yeah, it's very important in developed countries. If you will see, everyone is trained. Everyone know that how to do the CPR, how to do the BLS training. They are trained, and that's very important. That when if any patient is conscious, it's very common in Pakistan that they start putting water inside the mouth, and if there is any accident, they don't have
Yeah,
any
exactly. Mismanagement of the
don't
choking
have idea
station.
that
Exactly.
whom to call. I want to quote an incident when I was doing house job, I was house officer in Lahore General Hospital. I used to stay with that nearby at flat. So at night, I was going back after duty, and on the way, and there was Ramzan, I think, and there was a lot of rush. There is a bazaar, I think, I forget name, main bazaar. Okay, so what happened? I saw that there is a lot of rush. I went there, so there was a patient who had a grunt, and they were doing some massage like this. Okay, for two-person were doing massage on the hands, and hospital was 5 minutes away. I went there. I checked the pulse. Patient was alive. There was no, but then I think patient was unconscious. So I asked them to move the patient immediately to the emergency department. Hospital is 5 minutes away, 2 to 3 minutes away, I think, and they are doing their own thing. So that's very important in the awareness that what the public health officer, public health student they can do.
We should conclude now. Thank you so much, Dr. Vaidurahman Khizar, for dedicating your time and sharing your expertise. And thank you to all of you for joining us today. And lastly, I would say I encourage you to follow our Public Health Awareness and Training Center page on any social media page like on Facebook and LinkedIn for more details on future upcoming sessions. Have a wonderful weekend, and we look forward to having you to join us next time. Allah Hafiz for now. Thank you so much, sir.
Thank you, Padma, and thank you, Vikas, and all their needs. Okay.